Welcome to the deep dive. We're taking a look at Punjab's healthcare system today.
Oh, yeah.
You guys sent in some awesome sources, and let me tell you, it's a fascinating mix. We're talking about a system that's got its hands full trying to fight lifestyle diseases and tackle drug abuse, all while figuring out how to bridge the gap between what's available in the cities and
Right.
what's available out in the rural areas.
It's a constantly shifting system for sure. The government and the private sector, they're always, going back and forth, trying to come up with the best solutions. I think you're going to find some stuff about how Punjab handles healthcare that'll really surprise you.
Oh, I'm already hooked. So first things first, Punjab's public healthcare, it's built on this three-tiered system.
Right.
So you've got your district and your civil hospitals. Those are the big players in the urban areas handling the heavy stuff.
Mm-hmm.
Then you've got the community health centers and the primary health centers for the semi-urban and rural folks. And then right there at the front lines, you have the sub-centers and these new health and wellness centers that are all about trying to keep people from getting sick in the first place.
That's the whole idea, to reach everyone no matter where they live. It's not perfect, though. For example, think about this. Only about 20% of the specialist doctors, they're available to like 80% of Punjab's population who live in the rural areas.
Yeah.
That imbalance, that's a huge hurdle, and it's something we're going to dig into.
That's a big difference for sure. Okay, so the system has its work cut out for it. But before we get into all the tough stuff, let's talk about what the government's actually doing. I was really struck by the Ayushman Bharat Sarbat Sehat Bima Yojana, the ABSSBY. It's free health insurance for a huge chunk of the population, something like 75%. And get this, it covers up to 5 lakh rupees per family. Even treatment at private hospitals is included.
It's a big program. The goal is to make sure healthcare is affordable and accessible to most people in Punjab. One of the sources even had this case study about a farmer. This guy would have been totally wiped out financially by his wife's surgery. But because of ABSSBY, he was able to get her the treatment she needed without going into debt. That kind of impact. That's what could make this program so revolutionary.
That's amazing. Stories like that really bring it home, the real human impact of these policies. But I'm guessing it's not all smooth sailing, right?
Well, there are always going to be bumps in the road, especially with something this big. People are asking, can the program really afford this? Is there potential for fraud? And are these private hospitals that are part of the program, are they really up to par? These are all things that need to be watched really carefully.
Right. Having a good idea is one thing. Making it work is a whole other ball game. So it's not just about insurance, though. I'm seeing a lot here about the government trying to boost healthcare in the rural areas, too. They're upgrading those primary health centers and the community health centers. They're rolling out telemedicine so people in villages can actually talk to doctors in the cities. And they're even beefing up the ambulance services.
It's super important. Remember, most of the people in Punjab live outside the cities. One of the sources actually mentioned a study that showed just by making those PHCs better and getting more staff in those rural areas, infant mortality rates dropped significantly. When you put money into rural health care, you're putting money into Punjab's future.
That makes a lot of sense. Okay, this next topic is a tough one, but it has to be talked about. Drug addiction. It's no secret that Punjab is fighting a really tough battle here. The numbers are scary, especially when it comes to heroin and opioids, but it looks like the government is trying to tackle this head on. They've set up de-addiction centers all over the state. They've got those specialized opioid substitution therapy clinics, the 008 clinics where people can get medication to help with their cravings and withdrawal, and they're even teaming up with NGOs to provide counseling and rehab services.
It's a multi-pronged approach to a very complex problem. And it's not just about treating the addiction itself anymore. People are starting to realize that mental health is a huge part of this. So the government is now trying to include mental health services as part of those de-addiction programs because they're recognizing that things like depression and anxiety and trauma, those often lead to substance abuse.
So they're really coming at it from all angles, which is encouraging. Now, while we're on the topic of serious health concerns, Punjab also has this really high cancer rate, especially in the Malwa region. They're calling it the cancer belt of India, which is pretty frightening. What's being done about that?
It's a major problem, and the government is taking it seriously. They've partnered with Tata Memorial Hospital, one of the top cancer centers in India, to provide free treatment to people living in Punjab. And they've set up a dedicated cancer hospital in Sangru, trying to make sure people can get specialized care without having to travel all over the place.
So they're trying to make the treatment more accessible. I like that. Now let's switch gears to something a bit more hopeful, maternal and child health. It seems like the government is really making a push here. For example, they've got Mission Indradhanush going to make sure all newborns get their vaccinations, which is fantastic.
Vaccinations are huge. One of the most effective things we've ever done in public health. One source even highlighted a study showing that Punjab's immunization rates, they've gone way up since they launched Mission Indradhanush. And that means fewer cases of vaccine-preventable diseases. It just shows you how powerful, consistent, targeted efforts can be.
It's amazing how much of a difference a vaccine can make. And they're not stopping there. They're also giving financial aid to families dealing with childhood cancer through the Mukhyamantri Punjab Cancer Rahat Kosh scheme. And then there's the Janani Suraksha Yojana. It's all about encouraging expectant mothers to give birth in hospitals instead of at home to make deliveries safer.
All good steps. When a child has a healthy start, it affects them their whole lives. And that affects generations to come. Investing in mothers and children is investing in the future of society.
Okay, so it seems like the government is really putting in the work to make healthcare accessible and improve everyone's well-being. But I have a feeling there's more to the story, right?
Oh, definitely. We've just scratched the surface here. In the next part of our deep dive, we're going to look at some of the tougher challenges facing Punjab's healthcare system. And we'll talk about how the government and the private sector are both working on solutions. Get ready for some real eye-openers.
I can't wait. So we talked about how the Punjab government's taking action, but that urban-rural gap we mentioned,
Right.
It's a real problem. And the sources you guys sent paint a pretty stark picture.
It really is like two completely different worlds when you're talking about healthcare. Remember that stat? 80% of specialists all bunched up in cities like Ludhiana, Amritsar, and Chandigarh. It leaves the rural areas in a tough spot, often with primary health centers that don't even have basic equipment, let alone specialist doctors.
Yeah, one article had this story about an elder in a village who had to travel for hours in terrible pain just to find a hospital with a surgeon who could treat his broken hip. Makes you think about all the things we take for granted in the city.
Absolutely, and that travel time. In an emergency, it could mean life or death. This isn't just about convenience, it's about fairness, making sure everyone has a decent chance of getting the care they need, regardless of where they live.
For sure. And it's not just the distance either, right? It's the sheer number of doctors. We talked about the overall shortage, but when you look at rural areas, it's even more dire.
One source had this crazy stat. The doctor-to-patient ratio in rural Punjab is almost 3 times lower than what the World Health Organization recommends as a minimum. That means fewer doctors stretched thin trying to care for more patients. Longer wait times, less personalized care. It's a recipe for burnout among healthcare workers and frustration for the patients.
It's really sad. And then you add on top of that this other looming crisis, the rise of non-communicable diseases, NCDs as they're called. Punjab's being labeled the diabetes and hypertension capital of India.
It's true.
Over 60% of deaths in the state are linked to NCDs like heart disease, diabetes, and cancer. Those are some scary figures.
It's a silent epidemic, and it's hitting Punjab hard. One article connected to how lifestyles are changing in the state. Diets are getting higher in fat, and sugar people are less active than they used to be. It's like setting the stage for these chronic conditions.
Okay, but is it a lifestyle? Genetics have to play some role too, don't they?
Yeah, for sure. Genetics contribute. But the sources we're looking at, they really point to lifestyle as a major factor. One study even found that people in Punjab who ate a traditional diet, lots of fresh produce, lentils, whole grains, they had way lower rates of diabetes and heart disease compared to the folks who adopted a more westernized diet.
So it's not just what we eat, it's how our bodies have adapted to certain types of food over time. That's fascinating. But okay, back to the problem. How do we fight this surge in NCDs?
Prevention is key. We have to raise awareness about healthy lifestyles, encourage people to get regular checkups, and push for early detection. One source talked about how successful community-based programs have been, using local figures like respected elders or religious leaders to get the word out about healthy eating and exercise. That kind of grassroots approach can really make a difference in changing behavior.
It's about meeting people where they are, using voices they trust to deliver those important messages. But what about the people who are already sick? Is the healthcare system even ready to handle this wave of chronic diseases?
That's the big question. Remember that doctor shortage? Well, it's even worse when you're talking about specialists like cardiologists and endocrinologists and oncologists, the very experts we need to manage these chronic conditions.
So more people need specialized care, but there aren't enough doctors to provide it. It's a bottleneck. What can be done?
Well, this is where the private sector steps in. While the government's trying to catch up, private hospitals and clinics are filling in the gaps. They often have the latest tech, and can attract those highly skilled specialists.
Right. The private sector, we haven't talked much about them yet. It seems like they're becoming really big players in Punjab's healthcare scene, especially for things like cardiology, oncology, and neurosurgery. They're building these high-tech facilities. People are even coming from other states and other countries to get treatment at these private hospitals.
Yeah, medical tourism is booming in cities like Mohali and Ludhiana. One source even talked about private hospitals in Punjab offering these packages that combine medical treatment with cultural tours and spa experiences. It's like healthcare meets a vacation.
That's wild. But wait a minute. Isn't there a danger that all this fancy technology and focus on international patients could make it too expensive for regular people in Punjab?
It's a valid point. Treatment at private hospitals can be really pricey. And that can put quality care out of reach for a lot of folks, even with insurance schemes like ABS-SBY. There's a real risk of creating a system where the wealthy get one kind of care and everyone else gets something different.
That's not a good situation. So how do we make sure everyone benefits? How do we balance things out so these advancements help everybody?
One solution that keeps popping up in the sources is public-private partnerships, PPPs as they're called. It's all about the government and the private sector teaming up, pooling their resources and their know-how to create a healthcare system that's fairer and easier for everyone to access.
Okay, I'm interested. Give me an example. How would a PPP work in the real world?
Imagine a private hospital with a cutting-edge cancer treatment facility. They partner with the government to offer subsidized treatment to patients who can't afford the full price. Or maybe they work together to train doctors and nurses from rural areas, giving them the skills to handle more complex cases back in their communities.
So it's about using the strengths of each side to benefit everyone. But how do we make sure these partnerships don't just end up making private hospitals richer? Don't we need some kind of protection to prevent exploitation?
You're right on the money. Transparency and accountability are essential. One source talked about a successful PPP in Rajasthan. The government set very clear goals for the private hospitals involved, and they put a system in place to make sure things were staying high quality and affordable.
So it sounds like PPPs could really make a difference, but they have to be set up carefully to make sure everyone benefits fairly. We have to watch out and make sure private hospitals aren't just using this to boost their profits. They need to genuinely be expanding access to care.
Absolutely. It's a delicate balance. And speaking of complex issues, we can't ignore the big one, substance abuse. It's been a crisis in Punjab for years, and it's deeply intertwined with mental health. What's being done to tackle this incredibly challenging situation?
It's truly heartbreaking. One of the articles quoted a doctor who works at a de-addiction center, and it really stuck with me. He said, "We're treating the addiction, but we're also treating the pain." It made me realize that addiction is often a sign of something deeper. Maybe it's trauma, poverty, or lack of opportunity.
You've hit it right on the head. Punjab has one of the highest rates of drug addiction in all of India, especially for heroin and opioids. This crisis is tearing families and communities apart, and it's putting a huge strain on the healthcare system.
It's a complicated issue, but from what I'm seeing in the sources, just cracking down on drug supply isn't going to cut it. We need a more well-rounded approach, right?
Exactly. We need to put resources into prevention education and early intervention programs. We have to make treatment easier to get and more affordable. But maybe most importantly, we need to change how we view addiction. Stop seeing it as a moral failing and start seeing it as a health issue, something that requires compassion and care.
So it's about creating a system that focuses on recovery, not punishment.
Precisely. We need more mental health professionals, more de-addiction centers, more support programs out in the communities. But we also have to change how we talk about addiction. We need a culture where people feel safe asking for help without being judged or stigmatized.
It's about building a more compassionate and understanding society. But that's easier said than done, isn't it? How do we break down those deep-seated stigmas?
It takes time, effort, and a lot of different approaches. One source highlighted a media campaign in Punjab that used real stories from people who recovered from addiction to challenge stereotypes and encourage empathy. Another source talked about how important it is to train community leaders, teachers, and healthcare providers so they can recognize the signs of addiction and handle it with sensitivity and understanding.
It sounds like it's all about building a network of support where people feel safe to ask for help, and they're met with compassion instead of judgment.
That's it. It's about shifting the focus from punishment to healing, from isolation to connection.
We've covered a lot of ground, haven't we?
Yeah, we have.
From those government programs to the challenges in rural areas, the rise of those NCDs and the private sector's role. Oh, and of course, the fight against substance abuse. Punjab's healthcare system is definitely at a crossroads.
You got it. The decisions they make now, those are going to shape the health of Punjab for generations to come. It's a time for big ideas, creative thinking, and a real dedication to making healthcare work for everybody.
Okay, so let's try to sum it all up. If you had to pick out the most important things from all of this, what would they be? What should policymakers, healthcare providers, and just everyday people be focusing on?
With that urban-rural gap, it's a big problem. We can't have a system where good healthcare is only for people who live in cities. One of the sources had this interesting suggestion. Create a special program to give incentives to doctors who are willing to work in those underserved rural areas. Like, what if they could get their student loans forgiven or get tax breaks or even help with housing costs? Make it worth their while to take their skills to the places that need them most.
That's a smart move. Use incentives instead of just hoping for the best. But it's not just about getting doctors out there, is it? We also need to make sure those rural health centers can actually handle more serious cases.
Absolutely. Investing in equipment, giving them the latest diagnostic tools, making sure they have enough medication, all that's crucial. And then there's technology. Telemedicine could be a real game changer for rural healthcare.
Telemedicine keeps coming up. Imagine a specialist in Chandigarh being able to diagnose and treat someone in a remote village just through video chat. That could make a world of difference for people.
One source even talked about a pilot program that's using drones to deliver medicine and lab samples to those hard-to-reach places. We're talking about taking healthcare to a whole new level. But we got to remember, technology isn't a magic solution. It's just a tool, and it has to be used the right way. Plus, technology can't ever replace that human touch in healthcare.
You're right. It's about finding that balance. Speaking of balance, what about those NCDs, that silent epidemic we talked about? It seems like a lot of it boils down to lifestyle choices, which are hard to change.
You know, one of the most shocking things I read was that almost 70% of adults in Punjab don't get enough physical activity. That's a huge red flag. And it's not just about people making bad choices. It's often our surroundings that make it harder to be active.
So it's not just about telling people to exercise more. It's about making it easier for them. Things like building more parks and creating safe walking paths. Maybe even giving companies incentives to offer wellness programs to their employees.
Exactly. We have to build communities that support healthy habits. And when it comes to diet, one source mentioned how powerful it would be to use traditional Punjabi food as a model for healthy eating. Those dishes like sarson ka saag and dal makhani, they're full of nutrients, and you can easily tweak them to cut down on fat and sugar.
So it's about going back to those healthy traditions and making them work for modern life. Okay, so we've talked about making things better for patients, but what about the healthcare workers themselves? We've discussed the doctor shortage, but it's not just about the numbers, right?
No, it's also about creating a work environment that keeps talented people around. One source mentioned that burnout rates among doctors in Punjab are way too high, especially in those government-run hospitals. We have to fix things like overwork, low pay, and a lack of opportunities for professional growth. Otherwise, we're going to keep losing skilled healthcare workers.
It's like that saying, you get what you pay for. If we want a great healthcare system, we need to invest in the people who make it work.
Couldn't agree more. And last but not least, let's come back to substance abuse and mental health. This is where we need a whole new way of thinking.
Absolutely. We can't just arrest our way out of this problem. We have to start seeing addiction as a health issue, not a moral failing. One source pointed to Portugal's model of decriminalization. They took money away from punishing people and put it toward treatment and harm reduction. It's a bold strategy, but it seems to be working.
The results from Portugal are really interesting. And there are similar approaches being tried all over the world. They all focus on compassion, support, and meeting people where they are. It's about getting rid of the stigma and creating a culture where people aren't afraid to ask for help.
So it's about replacing shame with understanding.
Exactly.
Yeah.
And it's not just about individuals getting better. It's about building communities that can support each other, handle tough situations, and deal with the complexities of addiction and mental health. It's a long road, but it's one worth traveling.
I think we've given our listeners a lot to think about. Punjab's healthcare system has its fair share of challenges, but there's also so much room for innovation and positive change. It's inspiring to see the work that's being done and to imagine what the future could hold.
It's definitely a system that's evolving. And the decisions made today are going to have an impact for many years to come. The important thing is to stay informed, keep talking about these issues, and speak up for the kind of healthcare system we want to see.
Thanks for joining us on this deep dive. I hope you found it informative and thought-provoking. Remember, knowledge is power. And by staying curious and engaged, we can all help build a healthier world.